My name is Lucy Fraser. I am Head of Innovation at Albyn Housing Society based in the north of Scotland. We are a social landlord. We have just over 4,000 houses that spread geographically from Cape Wrath down to Inverness over to Skye. We were looking for something to support our tenants who were living on their own in some of the more rural areas, to have a technology that would assist them to remain in their homes for as long as possible. The system was ambient, so we have ambient sensors in the houses. This came from quite a lot of discussions with our tenants about what was acceptable. People didn't want cameras, they didn't want to be recorded, they wanted a system that happened regardless of their ability and regardless of what was happening to them on a day-to-day basis. So we developed a system of ambient sensors that reproduced people's day-to-day activity, with the idea that if we had that replicated over months and years, you could start seeing differences in what people were doing, how long they were taking to get dressed, how long they were sleeping. When we did it, it was always with the intention that the tenant had the power to do what they wanted with the data. We then had the barrier of how are we going to reproduce this in a manner that was easily decipherable by people who may be ill, who may be elderly, who may be frail. Had to be something generic. So we needed somebody that would question us until we honed down exactly what it is that we wanted to happen, but also we're able to go out and speak to various different people in both professional and tenants and supporters, so that they could understand each of these different clients so they could meet their needs as well. So it was always going to be a bottom-up scenario, and Waracle were quite clear that that's where they were in their development as well. What was really good was the experience that Waracle could bring to the project. So we have our own very small tech team. So with Waracle coming in, they could work with my team to establish what is the best way forward. If there were barriers, how can we get around it? And having that extra brain power around the table enabled us to break through into areas that we probably couldn't if we had just been discussing it in-house. Initially, we were going to do 32 properties with the technology. We've ended up doing nearly 70. We started off just putting it in new buildings. We're now retrofitting it. The outcomes that we've had so far have been such that we have now been awarded enough money to develop 200 further units. And what we're doing is targeting people on the care at home list who don't get care at home, basically because there's not enough people to deliver it at the moment. So they are eligible, there is just not enough staff to support it. Our outcomes from our first 32 were such that we had the backing of the Scottish Government and the UK Government to go forward to that next stage. Additionally, we are now working with a number of universities and looking at putting test beds into England as well as further south in Scotland, so that we can start developing a bigger number of cases, enabling others in other areas to have the same system that is simple, that is easy to use, that is affordable, that enables them to stay in their own homes while at the same time creating a data set that will be used for predictive health and care in the future. The growth of the project has taken off quite considerably, and in areas that we hadn't expected, and Waracle have been really, really good at bending and enabling us to meet all those challenges still within a very secure and very easy environment. There's a clear pathway forward. Waracle understand what it is that we need in the moment, but they also understand our trajectory, where we're heading, what this has to look like down the line. Our next stage with Waracle is going on to develop that more efficiently. The security and the access and the type of data will change dependent on who's reading it, and we're using Waracle to create these systems. So a multifunctional system, but within one package.